Welcome everyone to day 3 of Virtual Wish 2020. There is plenty more to come in this live stream and elsewhere on this platform, and I hope you've had the chance to connect with participants even in this virtual setting. Now, the next forum panel discussion is looking at digital technology and mental health, the tools of our age and how we can best deploy them, especially as we come to the end of a year that has taken a great toll on mental as well as physical health. Here it is.
It is one of the greatest challenges of our generation, how to effectively diagnose and treat the issues of mental health, especially in this time of technological advancement and a global health emergency. Hello, everyone. I'm Foli Batibo in Doha. On behalf of the World Innovation Summit for Health 2020, I'd like to welcome you all to this panel discussing mental health and digital technology. I hope you've all had a great virtual experience at WISH so far, and a big thank you, of course, to the WISH 2020 team, the Qatar Foundation, and all its partners for making this event possible today. Now, as we've heard over the last few days, this year has been an unprecedented one, an unprecedented challenge for billions of people around the world. The COVID-19 pandemic has not only presented an immediate threat to our health, it's also created an immense pressure on our mental well-being. The decisions we make now at this crucial juncture could have significant impact on how we deal with the aftermath of the pandemic on our mental and physical health. But the crisis has also presented us with opportunities to re-examine certain stereotypes about healthcare and also recognize the importance of digital health as the dominant future mode of healthcare delivery. Even before COVID-19 struck, mental health services were struggling in every country around the world, and the pandemic has made the situation worse. The WHO estimates the outbreak has disrupted or halted critical mental health care in 93% of countries around the world at a time when the need for mental health is increasing. So many countries have had to adapt, of course, to overcome these challenges posed by the disruption to in-person services. Many have adopted telemedicine, for instance, or teletherapy, but there are significant disparities in the uptake of these interventions. So how do we tackle this? How can technology and digital innovations help us revolutionize the way we deliver mental health treatment and services? And how do we ensure that the most vulnerable get the treatment they need? These are some of the questions that we'll be addressing today as we discuss the Digital Mental Health Revolution report, written and published for WISH under the leadership of Professor Helen Christensen, whom we have the great honor of having on our panel today, and also Dr. Tom Insel. This report gives us incredible insights into existing mental health needs and what can be done to address them. More on the report in just a moment. And we're also thrilled to have with us some of the most trusted experts on mental health who will be sharing their perspectives and solutions on how to develop digital mental health care and address inequalities in access. Let me introduce our panelists to you now. We have Ms. Deborah Kestel, who is the Director for Mental Health and Substance Abuse at the WHO, the World Health Organization. Also with us, Ms. Chiwendu Ukachukwu, a pharmacist and mental health advocate with the Lancet Young Leaders for Global Mental Health. Professor Miranda Wolpert is also with us. She's the head of mental health priority area at Welcome, an independent global charitable foundation. Dr. Dina Alfani is assistant professor and director of interdisciplinary programs at Hamad bin Khalifa University here in Qatar. And of course, as I mentioned, Professor Helen Christensen, director and chief scientist at the Australia-based Black Dog Institute. A warm welcome to you all. I very much look forward to this conversation today because it's an important issue that we're all facing, obviously, today. And I'm happy to say that this session will be a highly interactive one. We very much look forward to include questions from all of you who are watching us online today. So please do send us your questions in the comment section of your screen, and we'll attempt to put as many of them as we can to our panelists. And of course, by the end, we hope to provide you with concrete actions on how we can move forward on the issue of mental health in the digital age. Now, to kick off our event, we're honored to have a message from Dr. Olivier Véran, who's France's Minister of Solidarity and Health. Dr. Véran shares with us his thoughts on the importance of mental health and the opportunities with digital technologies to improve patient care. Take a look.
Her Highness Sheikha Moza bint Nasser, Chairperson of Qatar Foundation, and Her Excellency Dr. Hanan Mohamed Al-Kouari, Minister of Public Health for the State of Qatar, for inviting me to participate in the WISH Summit. Madam Director, dear Deborah Kestel, WHO Mental Health, ladies and gentlemen, professors, researchers, health professionals, dear all, it's my pleasure to join the World Summit on Innovation for Health and to speak specifically on mental health. Mental health is a priority, and I know that in Qatar, as in France, this topic has gradually moved to the forefront of our concerns. The World Health Organization estimates that 1 in 4 people will be affected by a mental disorder at some point in their lives, a situation that will affect not only individuals, but also their families, friends, communities, and caregivers. Leading causes of cost and disability, mental illness is ahead of cardiovascular diseases and cancer. Promoting good mental health, preventing mental illness, improving treatment and fighting stigmatization is therefore a real public health issue and a great challenge for society. In France, despite the health crisis, we are committed in a vast plan of reforms to meet this challenge. This is the roadmap on mental health and psychiatry, which is based on the 3 fundamental pillars of prevention, care, and support and community-based programs for integration. The challenge we are taking up is also to move away from vertical logics by fully involving users, health professionals, and all the players who will be required to contribute to the person's personalized care pathway. And I stress this point, a care pathway is also a life pathway. Combining cure and care is not a watchword. It's a small revolution in public health policies, and I am convinced that it is the key to take into account the person as a whole, his and her expectations, life, relationships with loved ones and friends, and his environment. New tools are emerging, and although we have invested digital technologies for a long time in the field of physical disorders, the time has come to exploit its full potentials in the field of mental health. Whether in the areas of screening, health promotion, early intervention, treatment, or relapse prevention research, digital technologies hold great promises. It's our responsibility to turn them into reality. One of the keys will be the ability of carriers and patients to contribute to the design and development of digital tools and to appropriate them. This is part of a whole issue of empowerment, a major issue for patients with mental disease. And this is a priority as long as we imagine a user citizen who is an actor in his own health, a partner in a growing digital ecosystem. This is a particularly important issue in mental health, since this appropriation, as we know, is a fundamental condition for recovery. Another issue to which I pay a particular attention is the promotion of rights and citizenship in persons with psychological disability, because each person, whatever their pathology, must be able to assert their rights and fully participate in the life of their community in the city. Here again, in this field, digital technology is an asset, and it will be one of the themes of the Alliance Interministerial Summit, Mind the Rights Now, to be held in Paris in the autumn of 2021. Until then, I wish your fruitful discussions on the challenges of e-mental health, and I confirm my full determination to give its rightful place in our health policies. This is also a call for scientific cooperation. It's a global challenge, and a summit such as yours will definitively help to meet it. By the way, I also wish you the best for the management of the crisis.
Dr. Olivier Véran, France's Minister of Health, for highlighting the need to exploit digital technologies to their full potential in the field of mental health. Let's now hear from our forum chair, Professor Helen Christensen, who is going to give us an introduction of the subject and overview of the report on digital mental health revolution. Take a look.
Well, hello, everybody. I'm really delighted to be here to present a very short summary of our report for WISH. I'm Helen Christensen. I'm the director of the Black Dog Institute in Sydney, Australia. And I'm here with my co-chair, Tom Insel, who will introduce himself as well.
Thank you, Helen. I'm Dr. Tom Insel from a Silicon Valley startup called Humanest Care. It was a real privilege to work with Helen and our colleagues on this report called the Digital Mental Health Revolution. I'll start by just saying that one of the main issues we had to deal with in thinking about what needed to happen for mental health care, both in developing and in developed countries, was to address the problem of engagement. We know that mental illness is very, very common. We usually think about 1 in 5 people being affected, 1 in 20 really being disabled by mental illness. So these are serious medical problems. And yet, unlike so many other areas of medicine, a big barrier to progress has simply been getting people into care. We sometimes talk about a 40-40-30 rule. Only about 40% of people ever seek care. Of the 40% who do get into care, only about 40% get really evidence-based, high-quality care. And of those, somewhere between a third and a half will actually show the full benefit of getting treated. So when we started to think about how we can begin to change that huge challenge of engagement, that massive barrier to getting care, technology becomes a really important opportunity.
Yes, I couldn't agree more, Tom. And I think one of the things that's happened, of course, in 2020 is COVID-19. And this has brought into higher profile the need to get services and technology-based services to people. We know that 75% of some populations are experiencing psychological distress. Many people are developing mental illness for the first time. And how are we going to deal with the scale of this problem? And I think we're really excited by the fact that, if you can be excited by COVID, that there is an envelope now about doing something where we can deliver digital therapies through the internet to people. And it's not just doing it face-to-face over Zoom. What we're talking about here is amplifying what digital can do and making mental health services more efficient.
We've been really struck in the course of doing this report by what we're calling a revolution. I think it is a revolution, that if there's one area of medicine that's going to be transformed by technology, it may well be this area of mental health because, as Helen just mentioned, we have the opportunity to democratize care, that suddenly the main vehicle of care, which is listening and speaking and going through a process of joining with someone in their pain and helping people to recover, can be done through technology wherever you are. And so high quality care can be delivered with now very much improved access in a way that we could hardly have imagined 10 or 20 years ago. So, what the report does is it begins to break that down and to show where that's happening, when that can happen, and what some of the best principles are for thinking about where the revolution is right now. In addition, one of the things we talk about in the report is what still needs to happen and where the challenges are in going forward.
Yes, Tom, I agree. And I think the challenges that are really one of the biggest challenges is actually trying to create the right sort of ecosystem, if you like, to allow digital and face-to-face services to work well together and to work well even better than what even the best health services can do simply face-to-face. I think that was one of the big learnings for me from this report, that we can do things better and more efficiently. We can monitor things better through digital health. We can have the scale and be able to reach people.
Yeah, I thought so as well. You know, one of the things, Helen, that I thought was maybe most useful in the figures that are in the report is it breaks the kinds of technologies that are available into two big clusters, one that are really focused on consumers and others that are focused on health systems. And both are important. And we have now an ability to look at the whole range of the kinds of care and the kinds of diagnostics on both sides that are already out there. And we're already seeing some big impacts. Lots more to learn about their efficacy. But clearly, we're at a moment where we can already begin to see that this is a game changer. We have the ability now, in a global sense, to have an impact on some of the most refractory and difficult problems in healthcare, which are really these mental health problems. We often say that there's no health without mental health. And now, for the first time, we can say we have a way of improving mental health outcomes, even maybe before we're able to do much on other kinds of chronic diseases. So, huge amount of traction, a lot of enthusiasm here.
Yes, and I think what we tried to do in the report as well was to give really good case studies of where things were happening and how they were doing different models in order really to showcase the ways in which people can move forward, governments, health systems, consumers, and so on. We looked at in Europe, in the US, in India and China, and in Australia to illustrate different ways in which digital is really finding a way forward. Because I think it is quite a complex environment that we're working in, and seeing these case examples really makes a difference to being able to conceptualize how it might work if you're a particular government around the world at the moment.
One other thing that we think is really going to be helpful in this report that we wanted to call your attention to, the digital mental health maturity model. That is, what we've tried to do in the report is to give people in any sort of role, any sort of position that would have to think about implementing mental health technologies, a sense of what are the issues they would need to look at and the maturity of these systems in different contexts. So issues around trust and regulation, funding and payment, the workforce, how they get integrated, monitoring and learning through this method as well. What we'd like to do and what we have in the report is an opportunity for you specifically to look at where your own needs would be and where the science is, what's available that can help to guide you into selecting the tools and in implementing them in your own setting. So we hope that you'll take a look at that maturity model, maturity matrix, as a way of taking what is essentially now just a white paper, but being able to put much of this into action. We had a lot of excitement in putting it together because we began to realize that not only are the tools beginning to become ready, but they're really, it's at this point possible to implement even in a variety of different kinds of environments.
Yeah, I think that what they're doing in that matrix, Tom, is really we're really trying to show that where you can already locate yourself in that matrix, and then you can see what the next step is. In addition to that, we've thought about the actors that exist out there in trying to implement and put into place these new digital ways of thinking and systems. And so we've broken down suggestions or recommendations according to whether it's a government person looking at it, a policy person, for example, whether it's investors or developers, what they should be looking for in the next move in the digital space, what health systems can do, and also from an educational perspective, what can educators do to use these digital programs, particularly in preventing the development of mental health disorders in young people, using school environments and other areas to other settings in order to do it. So I think that was a really useful thing that came out of the report as well.
In closing, we are really excited to be able to share this report with you. We do think that this is the moment that, as we often say, meeting the moment right now with all that we're dealing with this pandemic means getting ahead of what we think will be a mental health crisis. We already had a huge challenge before. The COVID pandemic makes this even more of a challenge, even more urgent than it's ever been. This report, we hope, will give you some of the tools that can help you address this and provide better outcomes in an area where the need has just been so great.
I'd also like to acknowledge the wonderful work that our team did, and I look very much forward to actually presenting the report very soon at the WISH conference. Thank you.
Thank you, Dr. Tom Insel and Professor Christensen, for that insightful look into your report. It certainly laid the foundation for our panel discussion. So let's get to that now. And let me just briefly reintroduce our panelists in case you're just joining us on this session. We have with us Ms. Deborah Kestel, who's Director for Mental Health and Substance Abuse, the unit at the World Health Organization. Chinwendu Ukachukwu is a member of the Lancet Young Leaders for Global Mental Health. Professor Miranda Wolper heads up the mental health priority area at the Wellcome Trust. Also with us, Dr. Dina Althani, Director of Interdisciplinary Programs at Hamad bin Khalifa University here in Qatar. And once again, Professor Helen Christensen, Director and Chief Scientist at the Black Dog Institute. Ms. Kestel, let me just start with you. And an important point that Dr. Insel made towards the end of his presentation there, and that is the impact of this pandemic, the coronavirus pandemic. Just how much more difficult has the pandemic made it to effectively diagnose and treat mental health issues?
Well, we have, hello, good afternoon, and thank you for having me here. We have come up with a survey, a report that was mentioned by Minister of Health from France, actually, that showed how the disruption of mental, neurological, and substance use services has been significant. And we are talking about 93% of countries among the 130 that answered to that question that have seen at least one service disrupted. And in that, it means that the capacity to reach out to those in need has been smaller, decreased. We do know that then around 70% of, again, respondent countries have make use of some sort of telemedicine, but we don't know. I think that many of the questions, comments just mentioned by Tom Insel are precisely related to that. We do not know what is the capacity that countries have to use that existing technology, and how countries manage to know what is the good, the useful technology or the useful tools among the 10,000 apps and 100 websites new coming up every year.
It's true that there are a lot of tools out there already. I just want to follow up on something mentioned in the report, Ms. Kestel, and this is the need, it says, to highlight across and connect across sectors, whether it's research, policy, and practice, to basically stop the siloed approach to digital mental health that exists right now and that can trade off evidence-based practices and engagement. So what sort of approaches would you advocate for better connecting researchers, developers, policymakers, and those people who are working on the ground? And have you seen the dynamics shift during the pandemic?
Well, maybe a beginning of a shift, and there are a number of strategies that one could consider. One, funding and project mechanisms that should be set up to ensure the existing evidence that is being used as the basis of digital mental health interventions. Those mechanisms should help in together researchers and developers by the one way to address this issue. And the benefits would be that they can work together, combine expertise on evidence-based approaches with expertise on engaging design and development process. We do have, for example, some tools, psychological interventions, PM+, that was developed as in a traditional way and is now being adapted by researchers into remote delivery version. And this is something that can help. Another issue would be digital mental health tools that should also be developed in partnership with end users. And I'm sure we will hear something about this later on stronger focus on users and application of human-centered design principles will help to enhance engagement factors and so make more accurate products at the end. Another possibility or issue to consider is that digital mental health interventions should also be made as possible open source. When interventions are created under copyright is hard, right? To ensure that access is going to be available for everybody, no matter the resource settings they have. And then, as I was saying, there are so many applications and tools out there that we need to have some clear guidance on which ones to be used and how.
Indeed, guidance is an issue because there are over 100 tools and websites out there already doing this. Dr. Alfani, let me just come to you and just go back to a basic issue when it comes to mental health, and that is the question of stigma. There's still a lot of stigma surrounding mental health in many communities around the world. And then when you come to young people, there's that added pressure of not appearing weak if they admit to having mental health issues. So how do we take that into consideration, Dr. Alfani? How do we take into consideration local customs and culture when designing these mental health tools?
Actually, firstly, thank you for the invite and for the interesting talks in the beginning. One most important factor, actually, which also Dr. Castell referred to, is the user-centered design. So if we want to design for a specific group, a specific ethnicity, a specific age group, and you want to avoid the stigma, you need to understand this group. You need to know their needs. How do they look at this specific problem? So therefore, we strongly in our field, which is human-computer interaction, we always stress on the user involvement and user-centered design. There is a lot of research that has been done in this toward this school of thoughts. In fact, also on policy making and in the world at large, the famous mantra that says nothing about us without us also lead to this school of thought that you need to communicate to the target group. Usually what we see now, the technologies available out there are targeted toward the Western society, towards society that consider mental health or look at mental health from a different perspective toward another parts of the world. So therefore, we need to include all groups, and by groups, I mean specific nationality, specific ethnicity, specific disabilities, and the different age groups that we look at when tackling mental health problems.
Yeah. Ms. Ukachukwu, would you agree with that? Did you find that the cultural relevance or lack of cultural relevance of the tools that exist right now is an issue? I mean, with Western users being used as a model.
Yeah, of course, especially for young people, there is need to create culturally sensitive content for them in mental health. So the different and diverse group need to be considered in creating digital mental health solutions for young people. because what matters to a community may not necessarily matter to another community. So there is need to create diverse but culturally sensitive content for mental health among young people.
And how do you achieve that?
So there is much need to these content. There needs to involve community developers in creating these, but most importantly, there is also need to involve tech developers, because for the lower and middle income countries, there may be access issue, access to the internet, access to data. These access issues are so much seen among young people. So it's a collaborative effort between different stakeholders, bringing the young people to understand their needs, community developers, tech developers. These people need to be there to create youth-friendly and culturally sensitive content.
And you make an important point that there are still inequalities when it comes to access in data, access to Wi-Fi for many communities around the world today. And we'll talk about how we as a global community can address that a little later. I just want to bring in Professor Wolpert. Professor, we talked about the fact that there are currently, 100,000 health mental apps that are already available to download, but there is a lack of standards for development, evaluation, and regulation, most importantly, of these tools, whether they're used for healthcare or self-care. So how then do we do things differently if we're going to create the next generation of treatments and approaches? And what does this mean in terms of the digital agenda?
So I think it's really helpful in this report that we do talk about both ends of that digital agenda that ranges from healthcare to self-care, and not see them as separate parts of the digital infrastructure. And in that, exactly as everyone said, there is a whole plethora of different ideas around about how to support people's mental health. What we're trying to do at the Wellcome Trust with colleagues around the world is trying to disaggregate those into their component parts, and to try and identify what are the active ingredients that really make a difference for different communities in different parts of the world, whether it ranges from cellular change to societal change, whether it's about changing how people think or how they sleep or what they eat or how they communicate or how they work in communities or how much money they have. Any of those aspects need to be thought about in terms of the digital sphere.
Right.
So rather than trying to find one evidence-based app, it's about trying to find the different active ingredients that might be dispersed across a range of different digital areas.
So what are these active ingredients that you talk about? What are they precisely, and what impact can they have on the digital future of mental health?
So they range from the biological to behavioural. I think the mental health science community is just trying to agree what they see as the most relevant and most important. There isn't agreement currently, and the mental health science community is quite fragmented in its views on these. But some of the things that people would, I think, probably come to agree on would be the importance of sleep regulation, for example, the importance of behavioural activation, doing things that are small pleasurable things to address anxiety and depression, the importance of changing mindsets to help you address or manage problem solving or address difficult thoughts, but also about communities and cohesion that we've really seen during the time of COVID, about how communities need to come together, because we know that loneliness is a major problem for mental health problems.
Indeed. Professor Christensen, so how have you seen the global relevance of the key messages of your report shift in light of the pandemic and reshaping of both mental health care needs and mental health care provisions in digital space?
Yes, thanks for that question, because I think COVID has really absolutely elevated the key messages of this report. We've seen this huge increase in telehealth in many countries. And I have to say, I have to preface this by saying, I only know the countries I know, and I do appreciate that there are different health systems and different access. But even in Australia, access to the infrastructure, the internet, is not guaranteed for everybody. So you get this variation across the world about what these structures are. And I agree, they absolutely need to change so that everybody has access to the internet. But I think we demonstrated during COVID that digital technologies show that treatment can be delivered through telehealth, and that there is absolute potential for scaling. It is a scaling thing. I think it's changed the views that people have around trust and the culture of digital. So there was a lot of suspicion, and clinicians were not all that keen about doing this. And I think because we've had to, because of social distancing, it's really changed people's views about digital. So it creates this great opportunity. I'd say it's amplified a variety of responses. So we have huge use of websites, COVID tele lines, mental health lines, social media. It's all gone up 30 or 40% during COVID because people have needed to reach out and communicate, but also to find out information. And also new treatment programs have been developed, which go from digital all the way to face-to-face. So offering some cohesive interaction between coming online and ending up with the potential of seeing somebody directly face-to-face. I mean, that is very new. That's really a different model that's occurred. And also there's been a lot of training about how to do digital amongst clinicians and so on. But in some ways, not enough has changed because I think we're still sticking to the old ways of doing things rather than looking at what digital can do that's different. So, you know, if you like, we've seen a shift from a room into Zoom, but haven't rather fundamentally rethought how digital can help. So there's a number of ways it can do that by the delivery of automatized suicide prevention ideation apps, for example, across the world, or online programs. These could be delivered right now, right, or having digital programs in schools.
You mentioned, Professor, the shift from a room to Zoom. Once the pandemic is over, hopefully soon, do you think people would have gotten enough used to this idea of Zoom, of having mental health care through Zoom? Or, you know, because a lot of people that I still talk to today say they'd rather have someone face-to-face than digitally. So how do we encourage people to move to that space now?
Yeah, I think it really depends. A lot of people don't want to go and wait, you know, for 2 hours to see a specialist. They don't want to get on a bus to get there. I think a lot of people have learned that there could be some models where you do have face-to-face with the clinician, but after that you can do mini interviews with your clinician. You don't have to have an hour to do something in psychotherapy. You can actually mix it up and get a different way and more efficient way in which health professionals' time is used. One of the statistics is one person can see 9 people if they use a blended program compared right. to just face-to-face.
Right. Dr. Alfani, I want to talk to you about the issue of privacy because there are already concerns when it comes to privacy online, and there are already concerns about privacy when it comes to using digital tools. So how do we then convince people to use digital tools on such a sensitive issue as mental health care when they're already very reluctant to use these tools on a day-to-day basis?
I think as my colleague have clearly stated, that the shift during this pandemic has made us somehow and to some extent trust in the technology. Of course, there are always the privacy risk. It's always there. However, the more trustworthy the sources, the more trust we as a user would have on the tool itself, the more affiliated this tool to research, and maybe because I'm a researcher, I'm more biased toward research, the more affiliated this tool to research basically sources, the more trustworthy the tool becomes. So, and I think of it in the end of the day, it's more of a perspective. And when we design these tools around the user rather than producing the tool to the user, and in the final stage asking the user to try this tool, so if we involve the user way in early on this process, we then gain their trust more. We then gain basically their engagement more. So that's my point of view from the privacy perspective.
All right. Ms. Ukachukwu, we talked about the disparities and the inequalities when it comes to access for many countries around the world. So what do you think, you know, rich countries where this is already picking up, what do you think they can learn from low resource communities in regard to developing digital mental health support?
Okay, so I believe rich countries will learn community supports from low and middle income countries. Here's what I found. most low and middle income countries use groups, social media groups, to discuss. So that offers some sort of community support to the participants using those tools. But most times in developed countries, they use personalized apps, wearables, and other very personalized and individualistic apps that may not bring or offer community support. There is actually very much need to create digital friendship benches that will mimic exactly the friendship bench we have when we used to have face-to-face interaction. So that will actually really be an important lesson developed countries will learn from low and middle income countries that use more of WhatsApp groups, Facebook groups. Why they still use digital technology? They use it in groups and not individually. So that offers the community support that everyone yearns for.
Yeah. Professor Walker, coming back to young people, do you think the impacts of poor mental health on children, on students, on young people in general have been carefully considered and quantified? I mean, how can the people surrounding a young person, families, whether it's schools, communities, how can they be better supported to help a young person find and engage with the appropriate digital tool?
So I think that there is an increasing recognition of the importance of youth mental health, and I think there are many ways to try and quantify it. We don't have fantastic tools at the moment. There's no objective measure out there, and there are 280 different measures of depression, for example, out there that people are using. So one of the things we're trying to do is to try and get policymakers and researchers and clinicians to all use some core measures in common, so we have a common language that helps us at least understand what we mean globally when we talk about having these mental health problems in young people. And I think for parents and carers, it's as others have said, there's no one right way. It's about helping people find the right way for them, which may mean trying out some different things and finding out what works for them in their context.
Right. Ms. Cassel, the report, just coming back to it, it highlights global case studies in various aspects of digital mental health care. What are the best examples that you've witnessed in your experience? What would you say is the best example of how this has worked?
That is a very difficult question that I don't know if I'm able positioned to answer. I don't think we have come up with the best. I think that with also summarizing what has been said, the role of the communities, the role of the specifics in each culture that can match at some points with the evidence and the research that is being generated is what will bring us there on what is the best. I like the expression that was mentioned before about the digital friendship bench. I mean, how do we get there, right? To the community experiences that were developed with using scientific evidence, but then becomes also specifically valid for the culture where it was developed. How do we move from there to some global context and parameters? And how do we use this current situation as an opportunity, as somebody said, right? We learned that it is possible to use digital care. I think we overcome some barriers there. Now it's a matter of saying, okay, how do we get there? And how do we make it, how do we generate hybrids that are a bit of digital care with a bit of traditional care and the community engagement in all of this?
Another barrier, Professor Christensen, is, I guess, investment. You know, the report highlights currently a discrepancy between mental health need and investment in digital between the Americas and the rest of the world. So how do you think that can be addressed?
I've just been listening to this fantastic conversation because I want to just go back to that quickly, and that is, you know, digital is a way for people to connect. You know, the friendship bench digitally is what happens in forums, and people do support each other. But I think for some mental health problems, we really do need that combination of clinician content and help, or not even clinicians, but that knowledge that is effective in changing people's thoughts and behaviors so that they improve. So I really do think that this mixture, as was just said, between community and the knowledge that's required or has been acquired through clinicians over a long time, which can be shared digitally, is really the ultimate way to do it. It is a question of funding, and it's a question of funding even in America, where there's so many of these apps being developed, because it's got a very much a capitalist market view. In other countries like Australia or Sweden and potentially the UK, it's much more around governments helping to fund the development of a particular intervention. So you don't get that commercial startup type frenzy that you often see in the United States. So I really think that it's ground up. The way in which you can build digital interventions at ground level in every country really comes from the people, and they have the knowledge about what engages people. And when young people see something that's in their language and it speaks to them culturally, they will use it. Whereas, obviously other digital products just won't be of use to them.
Right. And I just want to remind our audience who are watching us right now, if you have any questions for any of our panelists, please do send them to us. I think we very much want to hear from you as well. We want you to be part of this conversation. So just put the comments in the comment section of your screen, and I'll pass them on very soon to our panelists. Let me just come back to Ms. Ukachukwu one more time. If I can ask you, Ms. Ukachukwu, about your experience. I know that you've supported the development of WHO tool to assess mental health needs in emergency settings, in an emergency situation. So what mental health needs did you see arise in crisis settings, and what can we learn from them in order to develop the right support, the appropriate support in this current global crisis that we're all facing?
Okay, in emergency settings, like in different emergency settings, there is much need to integrate mental health service provision to the primary healthcare service that are being offered there. Most people in emergency setting had post-traumatic stress disorder, but their services, the mental health services provided to them, wasn't integrated into the general primary health care. So there is so much need to integrate mental health services as a basic form of the primary health care provided for people in emergency settings.
Okay, thank you very much. So anyone else want to add to that? The needs observed in times of crisis, and how we can learn from past experiences to apply to the current experience we're living through. Dr. Kessel, perhaps.
Well, I'm not sure I get fully the question, but while listening, I was thinking about experiences that we collect at the point in just anecdotal way of support that is provided to people in emergency settings that are due to the current situation, the COVID-19, and that is actually far from any sophisticated, newly developed app, but is more focusing on using the technology that is at hand to provide the support that it can be offered at the time. I'm not aware of any specific, again, newly developed tool that has been put in place.
All right. Well, that was an incredibly important and meaningful discussion. I want to thank you all very much for sharing your ideas with us and offering solutions on how we can address this critical issue. We have questions now from our audience who have questions about how we can move forward. Okay, so questions, audience questions. I have one here, and perhaps I'll put that to you, Professor Christensen. What is the one message that you would want a health system leader to take away if they're considering embedding digital tools in their mental health care systems for the benefit of entire communities? What's the one message you would push?
Wow, that's a hard question. I certainly think that looking at what is already existing and seeing where health systems are going, and then working out what the goals and aims are of your need, your health service, and then designing it backwards so that digital can be actually enhancing that service. So, you know, we tend to just think about what's required and think in old ways. But really, if you think backwards and try and map out what are the digital technologies that can fit in to facilitate those sorts of goals that you have for your health system, I think that's the first, a pretty important thing to start with.
Professor Wolpert, I guess the same question to you. I know that Wellcome is a strong proponent of ensuring that those with lived experiences on mental issues are involved in all aspects of developing mental health support. So what advice would you give to global leaders thinking about how and why to engage patients and the public with lived mental health experiences?
So I think it's, as Helen was saying, it's designing around the needs of those you're trying to serve and making sure that you are meeting those needs and looking at their needs for wellness. And as I think Helen was saying earlier, those needs will vary depending on the type of mental health problem that people have and the range in which there could be for self-care through to healthcare needs in relation to that. So I think there's a real opportunity here for us to rethink how we provide care, but also how we empower people to make their own decisions within that. And there's an opportunity for both policymakers and healthcare providers to join forces in that.
Right. Thank you for your answer. Dr. Alfani, one here for you. How can we design digital tools to ensure that they're inclusive and that they support mental health and quality connections while avoiding potential harm such as screen addiction concerns?
That's a very good question, actually. So screen addiction has been correlated now in the literature to mental health problems. And terminologies like the fear of missing out, which refers to an individual feeling the need to always be online, always be on social media, has also been strongly connected to internet addiction, and that leads to anxiety and disorder. And those symptoms exhibit behavioral addiction that is also basically treated from a psychological interventions. How can we sort this out? I strongly believe the tech giants has actually a hand in worsening such a situation. And what I believe, what I strongly believe is involving the user from day one of requirement gathering, having the user, your target group, as a member of the design team, and there where the terminology participatory design or collaborative design come through. And I feel to design such technologies that would be of help, we will always need approaches such as co-design and participatory design. However, I know these approaches are very challenging to put on in the real world, but I think we have to try to do that.
Yeah. Ms. Ukachukwu, your thoughts on this? How do we design digital tools while also taking into account the potential harms that these tools can create for young people, especially, screen addiction concerns and so on?
Okay, so there is much need for regulation of the 1001 mental health apps and services out there. But most importantly, there is need to co-create with young people, because you can't understand their needs and you can't talk about them without them being involved. And when they are involved, there is need to empower and encourage young people. But most importantly, there is need for an integration between app or web-based services and the community services for full participation and usage, especially among young people. And interestingly, there is need to expand internet access. Internet access should actually be a basic human right, especially in this our times and age. So young people can have access to internet and they will be able to access services online and utilize the digital solutions being provided out there. Thank you.
Thank you for your response. Thank you. Ms. Wolpert. Ms. Ukachukwu mentioned an important point there, regulation. As she said, there are over 100,000 mental health apps currently available. If digital mental health is going to be the thing of the future that everyone turns to, who should be responsible for regulating it?
So I think the digital mental health revolution also requires a revolution how we think about regulation and control, and how we think about who controls data and in what forms. And I think there's a real danger sometimes that we set up false dichotomies between people being more concerned about privacy than public good, for example. If you ask end users themselves about what they want their data to be used for and in what ways, they may have different ideas about openness or others, for example, for research, than commercial providers may have. So I think that it's really important here not to impose old models on our new world. We need regulation both for healthcare that's face-to-face and bricks and mortars based, as much as we do for healthcare that is provided by digital. And we must make sure we don't set higher standards for digital because we fear it's new and we don't understand it in the way that we haven't imposed on bricks and mortar healthcare. So I just think we need to be careful here that we have an opportunity to create new ways of empowering end users to have control and make decisions for themselves whilst also protecting them. But it won't be the old system of regulation.
Professor Christensen, your thoughts on that? Who should be regulating this?
Oh, I really like Miranda's answer, because I think, first of all, around data, the user should own the data. The user should own the record rather than somebody else owning it. But I do think that governments have a role to play in regulating, to some extent, standards. Just like they have standards in regulating healthcare services, they should have standards in regulating mental health or digital services. So I think there's a parallel thing there. I feel that we also I've just done a review on the effects of screen time, and I think to some extent, while I'm cognizant of the fact that there are these correlations between it and understand the points that have been made, I don't think we actually know the extent to which the digital is actually causing people to be more depressed, or whether people are seeking digital for solace or for the wrong reasons and so on. So I think we have to be very careful about these relationships between digital, which is also being used, I think, sometimes to make the argument that, you know, for example, suicide rates are going up because young people are exposed to digital technologies. And I just don't think we have enough information yet to know that's the case. We should be careful. I agree we should be careful, but I think we have to really look at these and if you like, the last 20 years that I've been working in this area, these views come up all the time, and yet we really do need to keep challenging them, as we can see some of the positive things around digital health as well.
Okay. Ms. Castell, another question here from our audience, and this one asks, building on the use of data from these tools, what benefits can digital provide to research that understands mental health needs that we can't get from traditional methods?
And thank you for this question also, because I wanted to make a comment in the previous one, and this is related. I mean, I think that we should not forget some of the comments that were made at the very beginning. The number of people with mental health issues has already been big and considerably before COVID. We are seeing now a trend that is maintaining or increasing some of those numbers. And what we knew from before and we know now is that the services out there are not available. And so although digital care is maybe great in the possibilities that offers, including regarding new data that can be made available, the responsibility is, in my opinion, from governments to make sure that services are out there that are responsive to the broad needs of the people with mental health issues, including whatever is available in the context of digital area. So if there is a possibility, as I was saying earlier, to establish a regular mechanism of exchange between developers and science researchers and policymakers, then the data that is generated can be used to improve the situation. But there is something that was mentioned not too deep maybe for the next opportunity, and is the need to increase funding for mental health from the government.
Where do you get the funds from? That is a really important question.
Because we don't, I mean, the funds globally that are spent in mental health are 2% of the health budget. And we are saying the mental health is so important and the numbers are increasing and the impact is huge, but there is no funding to those
Why
needs.
do you think that is? Why do you think, despite the needs that are out there, the funding is still lacking? What is that down to?
I think that the knowledge about mental health is still developing, although for us, some of us working for so many years is so clear, right? But the stigma is still high. The priority has been forever, for many, many years into traditionally communicable diseases, and we see why, right? COVID is impacting us. But then the role that mental health conditions have in populations has been minimized, has been ignored, has been not considered. So slowly, we are bringing evidence with all the work that is being done from these different aspects, and hopefully we'll be making the case to explain to policymakers and demonstrate to policymakers that there are problems, but there are also solutions. And if we want the solutions to happen, we need to invest in those solutions. And the solutions are broad and diverse. That's another reason probably why mental health has been lagging behind. There's no one particular, there is not a vaccine that can prevent or eliminate the mental health problem.
Indeed.
It's much more complex than that.
Indeed. Dr. Al-Thani, can you tell us about the experience here in Qatar? We talk about mental health, being still surrounded by stigma in many communities. And we talked about, the lack of funding in many communities because of that stigma. What is your experience here in Qatar in dealing with this issue of mental health?
From a research perspective, in terms of funding, actually I was part of a grant led by Dr. Muwaffaq Housa, who is actually one of the people contributed to this report, and it's on digital mental health and chatbot, intelligent chatbot. So in terms of funding in Qatar, I see, in fact, this is highlighted actually as one of the priority areas within the Qatar National Research Fund Institute. But as well, in terms of the medical or the public health in Qatar, there is, I see a lot of campaigns that happens during COVID and prior to COVID that highlights the importance of mental health, and basically people taking the initiative if there is a problem to come forward and seek for help and ask for help.
Okay, one last question for Ms. Miranda Wolpert, and this is also a very interesting and important question, and it's how can research keep up with the tech sector, which is innovating so quickly, and but we still need evidence about what works. How can the research sector keep up with the tech sector?
Great question, and 2 points on that. I think we are in the midst of a digital revolution for mental health science, and the opportunities are amazing. Tomorrow we'll announce the launch of our first global mental health data bank, which will try to draw together some of the things we've talked about today and some of the principles of the report, where young people are helping form ideas around what data should be collected about mental health and in what form, in a way that can be shared with researchers globally to try and understand what helps prevent and address anxiety and depression in young people. And if we can find ways of doing that that can be scaled, then those are the ways that digital can be enhanced to revolutionize research. The second way, I think, is that we need to find ways of having really productive partnerships with commercial agencies, the big tech players. I think, as Helen said earlier, and as others have said, we've got to be really careful not to demonize, whilst also recognizing some of the difficulties and tensions between the commercial agenda and the research agenda. But if we can find a way of collaborating here and finding sweet spots where there is a health compact around what good health looks like for the users of those big tech platforms, then there is an opportunity here to do research at scales that have never been thought of before.
Collaboration is the key word, of course. That will bring this discussion to an end. We'll end it on that note of collaboration. Thank you all very much for your insight and sharing your views and experiences with us on this very important issue that is mental health in this digital world that we live in today. And as we've learned from the report, the next generation of technologies need to combine the best of clinical science and consumer engagement. Developers and healthcare providers alike need to come up with solutions that are different from traditional mental health services. A profound change and shift is needed, as we've heard from all of our panelists, and technology will help achieve that. As we deal with the COVID-19 crisis, it's become even more critical today that we focus on the well-being of our mental health. And for that to happen, there needs to be massive interventions that reach millions of people. There needs to be a next generation of digital mental health innovations connecting across sectors, from research to policy and practice, while ensuring at the same time that there's equality in access and that it's tailored to the needs of different cultures and communities. Thank you all very much once again for your valuable insights, to our online audience for watching and taking part in this important discussion, and of course to the whole Wish 2020 team, the Qatar Foundation and all its partners for making this event possible today. I'm Foli Batibo in Doha. Thank you very much for being with us once again. Have an excellent day.